Welcome back at 7:15. November is dedicated to COPD awareness. Over 16 million Americans suffer from the disease, and it's one of the leading causes of death nationwide. With us this morning is Dr. Brent Wallis from People's Health to talk about, number one, what COPD is exactly, ways to see the signs, recognize the signs, and details on lowering your risks and treatment. Dr. Wallis, good morning.
Good morning. Thanks for having me.
Of course. Let's first talk about what COPD is exactly.
Yeah, sure. So COPD, or what we call chronic obstructive pulmonary disease, is really an umbrella term that we use for a couple of different really common lung diseases. The first is emphysema, and the second is chronic bronchitis. And actually, people with COPD can have elements of both of those.
And so basically, COPD is an umbrella that all of those different diseases fall under. Is that correct?
Yeah, and what happens is it's actually a similar process that occurs in the lungs. And, I think everybody knows when you take a deep breath in and inhale, you're actually moving air into your lungs and you're exchanging oxygen for carbon dioxide. And what happens with emphysema is the little air pockets in your lungs become stiff and rigid, and they can't actually expand. And then with chronic bronchitis, the bronchioles, or the tubes in your lungs, can actually become inflamed and full of mucus. So both of those actually cause difficulty in transmitting that oxygen, which you need to actually fuel all of your cells.
Dr. Wallis, let's talk about ways to lower your risk, or I guess causes first, and then ways to lower your risks.
Yeah, so predominantly the most common cause that we see is smoking. So about 80% of COPD related deaths in the United States are actually due to smoking. So that is really the most important. We do occasionally see people, about 1 in 4 times, that develop COPD diseases that have never smoked, and that's typically because they've got a workplace exposure, so fumes or smoke that's happening in the workplace as well.
And anything I know treatments are changing constantly. Anything new on the treatment front for this umbrella of this COPD umbrella and the diseases that fall under it?
Yeah, sure. There is a lot of advancements lately. The diseases all have very similar symptoms, and they vary from person to person. We typically see wheezing and shortness of breath, really productive cough, and a lot of fatigue. And so the treatments are actually designed to help open your lungs and actually facilitate that air movement so the oxygen can get in and out. So we use a combination of medications, particularly inhaled medications, but also something called pulmonary rehab, where you actually learn to take deeper breaths and actually move air more efficiently through your body. So there definitely are treatments for it.
And Dr. Wallis, in our last few seconds here, can you leave people with some information on resources for smoking cessation? I know that's a huge one, or if they are dealing with one of these diseases, resources as far as treatment and therapies are concerned.
Yeah, absolutely. The first place to go is your primary care physician to talk to them about those resources. It's really great in Louisiana. We have something called the Louisiana Smoking Cessation Trust. So you can actually Google that and reach out to them. They can actually provide some assistance with smoking cessation, including medications to help you stop smoking. Because the most critical with COPD is that you have to remove the irritant. So if you developed it because of smoking, you've got to quit smoking.
All right, Dr. Wallis, as always, we appreciate your time. Happy Thanksgiving in advance to you and your family.
Thanks, you too.